There are so many of you who are here today for the first time with the Eating Disorders Coalition for our April Lobby Day of 2010. And you're not only here because of the hard work that goes on behind the scenes at the Eating Disorders Coalition with our staff, but you're here because we have somebody, a member of Congress, who has been by our side since the coalition existed. Without him, we would not have the FREED Act. And without him, so many of us would not have hope. I know I wouldn't have hope, because on the days when I'm fighting for people's insurance company to cover the life-saving treatment that they need, and I find out the person has passed away during the time that I've been arguing with their insurance company, the one thing that gives me hope is our FREED Act. And the person behind that is our champion, our friend, who has never let us down when we have felt down in the trenches that there is no hope for the elimination of eating disorders, for coverage of eating disorders, for research funding for eating disorders, for education and prevention of eating disorders, and I also have to say for the stigma of those who suffer to finally disappear. I think that we owe a huge debt of gratitude to Congressman Kennedy, who is with us now, and I'd like to invite him up to speak. Comment one quick thing on Congressman and the personal hope that he has given me. You were featured in an article in the Washington Post last year, and in that article...
Good thing you said that article, not...
I went for a drive. So the article in which you were featured, you said that because of your struggles, you had always felt less than. That you came from a family who was strong advocates for the civil rights movement. You came from this great family. Because of your disease, you always felt less than. And when mental health parity became something for you to work on, you started to realize that you didn't need to feel less than. And that was the first time that I didn't feel less than in my family, and I have passed that on to so many people who I work with. And I just want to thank you for that.
Thanks, Catherine. Kathleen, and thank you for your stewardship on this issue and your heartfelt commitment and the fact that you have been prepared from the very beginning to tell your own story and be an example to others of breaking the stigma, which is the biggest battle we all have to face. You know, we all kind of tittered when you talked about an article, because there's an article today, roll call, about at an event a week ago where people talked about me drinking. And of course I got lots of people advising me today as to how to respond to it, and also chastising me and saying how this was going to really put a sour note on my political career, because I was going to go out, you know, with this shame, this cloud of shame over my head, and then say, oh, poor Patrick, you know, we hope he tackles his demons, you know, it's a good thing he's leaving Congress. And it was interesting because I was walking back from the floor after having been handed, you know, about 4 dozen cards from the press gallery wanting to talk to me. And you'd think there's nothing else that's going on in the world besides my personal whereabouts after 11:30 at night. But in any event, he said to me, because he and I share the common disease, and he said to me, you know, when you think about how long we've both been at this, we've been in recovery a lot, you know, shorter time than we've been out there doing our thing, and you know what? It's more abnormal that we're sober than it is, you know. And he says, you know what? You know, what do monkeys do but eat bananas? And I said, what the hell does that have to do with it? But he said, well, you know, right now it's our nature until we change it. We work every day, one day at a time, to try to change our nature. But and that's work, especially if you've conditioned yourself over the course of a lifetime to turn to a certain escape to help address your feelings. Because when times get tough, your natural inclination is to go there. And the fact of the matter is, the stigma is there. Because why else? If I had an issue with my sugar, if as a diabetic, they would not be passing cards, as many of them, into that floor of the house, wondering, did I eat chocolate cake for dessert instead of have, you know, however many shots of vodka. So the stigma is alive and well. And the fact of the matter is, I have been so proud to be part of the movement to try to erase stigma. But I'm certainly very cognizant of the fact that there is almost a bigger responsibility on me to try to practice what I preach in terms of being, you know, the picture of sobriety. And one of the biggest challenges, and one of the reasons why they say for those who are in sobriety to remain anonymous, is because we're all individuals with our challenges, and we can't be some example to others in a public way of sobriety, because all of us have failings. And if we're the one that someone looks to as the model, and we're public and we fail, then oh my God, you know, we set a bad example. So that's the reason why anonymity is so important. On the other hand, I've heard too many people say, because of the 11th tradition, well, I can't get involved with those politicians or step forward and announce myself as in recovery, because if I do that, you know, I'm violating the 11th tradition. Well, come Cancer Day, I look down the hall and I see loads of people. You know, come Diabetes Day, I see loads of people. But on come, you know, Mental Health Day, I look down the hall, and, you know, I can hear the echo of my voice. The silence is deafening. Because, in a sense, we're our own worst enemies. Those of us who are in self-help groups who have subscribed to that 11th tradition and misinterpret it as meaning that we're supposed to be anonymous in our civic duties. Now, you all are understanding that you have a civic responsibility to stand up and be counted, because you are doing it not just for yourselves, but most importantly, for others that are facing the disease that you face. And if you don't stand up and petition your government to respond, you know what? This government doesn't just do things because it wants to and thinks, oh, well, what a good idea that is. Oh, well, you know, that's the smart thing to do, and, you know, science tells us that's a disease. So I think that's something that we should cover. If that were the case, civil rights would have passed a lot longer before it ultimately did. If that were the case, you know, a lot of things would have happened well before their time. But they didn't. Why? Because the public pressure hadn't come to bear yet. So it's not about what we know to be true, it's what we can demonstrate through political action to be true by virtue of us showing up in members' offices, making the phone calls, during campaigns, being willing to say to the candidate, how do you stand on the Freed Act? If you don't know what it is, let me explain it to you at a town hall meeting. And now we've got the same bill in both chambers, thanks to Senator Harkin. So, and now's our opportunity to also build coalitions with other people in the community of fighting for parity and fighting for equal rights. Because frankly, we're all together in a bigger fight against those who would deny people their human dignity simply based upon a pre-existing condition that they have, a disease that's well recognized, and frankly, in doing so, also denying an epidemic in this country in behavioral health that we just have totally neglected in terms of the approach to healthcare as a whole. We don't train our medical professionals whatsoever. There's no requirement in medical school. No state boards testing physicians, nurses, and the like test on whether you have any ability to really identify depression, whether you can ask proper questions to determine whether someone's suicidal, whether you can identify or know how to treat someone with an addiction, whether you can do that brief screening and intervention, whether you can identify people who are suffering from things like eating disorders, whether you can measure these things and how they interrelate, and how crucial someone's emotional health, spiritual health is to their physical health. Because we spend so much of our money in this country at emergency rooms picking up the pieces of people who've been broken inside and manifest that brokenness through high-risk behavior and self-destructive behavior. And, you know, the fact that in our Trauma 1 centers, when we did our hearings on parity around the country, we had, emergency room physicians testifying to this effect. Oh, we've got people coming in with back pain, stomach problems and this and that. And, it's just a manifestation of it. And the fact of the matter is, this, issue of manifests itself in so many different areas of mental health. And that's why we all have to stick together. We've got our work cut out for us. The good news is, what we need to do is, you've seen the last couple of weeks, front page stories on obesity. It's the rage right now. Okay? The First Lady's on it, the front page of the magazines. You can't go to a checkout counter now reading about every major publication's doing stories on it. The rate of diabetes is going through the roof. Everybody in this new health-conscious, total health system is acknowledging we want to do something about that. The good news is, if we can broadly define eating disorders, then we can cover the whole person. Whether that eating disorder is bulimia or anorexia, or that eating disorder is obesity. Because guess what? 2/3 of America who can't stop eating are putting on weight that is putting a burden on their heart, on their kidneys, on their whole bodies. That is unhealthy to them. And that is an eating disorder that people wouldn't, stand up here and say, that's an eating disorder. No, they wouldn't say that, because there's too many Americans who suffer from that eating disorder and won't for a second call it a disorder, because they wouldn't dare say that they've got a problem. So, I think in terms of stigma, we could go a long way if we can tie ourselves to that issue, because in essence we'll be educating people. At the same time, we'll be hopefully hooking our car to a train that is going to be going down the tracks in terms of Centers for Disease Control, which is part of our bill, in terms of education to providers, which is part of our bill, which is more funding for research, which is part of our bill. You name it. It's all together. And that's where we need to think creatively about how we're going to make this thing happen. The other thing is, we've got to think big too in terms of mental health in general, how crucial it is. I don't know how many of you saw Sunday's New York Times about are returning veterans going to Fort Carson in this wounded warrior casualty, unit, and like wanting to commit suicide from being in the place. It was like, that first Hippocratic oath, first do no harm. Well, it appeared as though this place was driving veterans who were already traumatized into an even worse predicament in terms of their mental health and their situation. The bottom line is we haven't even scratched the surface in this country in terms of how we're going to properly reach out and wrap ourselves around these American heroes. Them and their families, who are equally American heroes, because they're the ones who've been sitting at home, watching the TV, worrying every day about whether their loved one's going to come home. And I might add, that loved one could be their mom as much as their dad, because of the huge percentage of our standing military, which I include Guard and Reserve, because now they're part of the total military with the number of times they get called up. That is why we need to work on this, because right now all the insurance companies are suing the government because they don't want the implementation of the parity provisions in the basic benefits package. By the way, this health bill we just passed is the biggest mental health bill ever. It wasn't publicized. No one knew about it. Thank God. You guys, it would have been one of those things that people would have objected to. They were too consumed with other objections. They never got around to us. Okay? So, the bottom line is, though, our fight is in their fight, because most vets don't get taken care of by the VA. They're going to be taken care of by a regular health system. So, we can say, we're helping you because your fight is our fight. And when you fight to make sure there's implementation of this parity, because we don't want our vets to have that medical necessity loophole applied to them and say, oh, sorry, we have this guaranteed coverage, but you don't rise to the level of medical necessity. That sound familiar? Well, we want to say it's because of our vets we're not going to stand by and let this medical necessity become the loophole by which you deny mental health coverage to our nation's vets. It's a lot more palatable to the American public, frankly, than trying to stand up for my antics and say, oh, Patrick, he needs to get it. Well, listen, he doesn't really need it, deserve it, Because people make judgments on all the mental illnesses and what order of merit they have. That was our biggest challenge in the mental health parity fight. Initially, a big portion of the mental health community said, we're just going to cover the biologically based illnesses. What that meant was they were going to double stigmatize the non-biologically based illnesses. Until we got to the point that we said, hey, unless we include everybody and make it a matter of principle, we're going to cut off our nose to spite our face in terms of we're going to eliminate the strongest case we have, which is we're all one, and you discriminate against one, you discriminate against all. We're going to lose the whole argument that there's parity between physical health and mental health. If we start cutting out some of our own, we can't stand on that principle. And that's why we've got to go to the other folks in the mental health community and say, you got to stand with us. Because if we are systematically denied, and that medical necessity thing's, woven around, and there aren't enough inspectors at Department of Labor to, enforce this law, and guess what? It's a tight budget year, and I wonder how many people are going to be able to enforce the appeals that you're going to file. Hopefully, when you get denied, your families get denied, you're going to call up and say, we got denied. You're going to want to make sure there's some federal investigators to go in there and call up Anthem and United, even Blue Cross, Aetna, and say, hey, listen, law says you can't do that. Well, that's only going to be as good as there are a number of people who can follow it up. And that's where your fight in our fight, we start to really work together, and everybody in this together. So we've got to show up at their events too. So they see us, and they know that we're in their battle. And we've got to invite them to our rallies, so they see that they're part of our fight. That's this business here in Washington. It's a game of addition. And I will tell you, in that regard, Kitty, Jeannie, we've just seen an increase in just the last couple of years. We used to meet in a closet. There were that many who showed up for this. So I will tell you, the fact so many people like you are here, in itself testifies to the progress that's being made on this issue. Because like I said, the biggest battle of all is not the political battle of the insurance company. We'll take care of that, provided we first have people showing up and ready to take on stigma. Because it's stigma, first and foremost. We get that out of the way and nothing can stop us. So keep on the fight. We're with you, and we're going to keep fighting until we win this.